Joining us today is a psychiatrist who practices in Virginia. Hello, Dr. Casper Thompson, and thank you for joining us for this conversation.
Hi, thanks for having me.
For the first question I have, for our viewers who may not know you, can you first give us a little introduction and tell us about your background?
Sure. So, I'm Dr. Thompson. I am a senior psychiatry resident, graduating this year. Um, I've had an interest in mental health, especially in the African American community, and so chose a residency that would help accommodate and facilitate some of those training goals, as well as helping to give back to my own community.
Okay, great. To some people, mental health, I know, can be seen as a stigma, causing many people to suffer in silence and not seek necessary treatment. Um, as the coronavirus pandemic raises the stress and anxiety levels for Americans, what are some solutions that you suggest can help individuals manage this?
So I think the first thing that would be important would be to normalize these feelings. A lot of times we feel it's important to be strong or not really show how we're really feeling. So I think one of the most important things would be to be okay actually verbalizing that you're feeling stressed and you're feeling anxious, whether or not you have a previously diagnosed mental illness, because we're all feeling stressed and we're all feeling anxious. And that's an appropriate reaction, an appropriate response. So I think actually naming the feelings and naming the emotions that you're experiencing is very helpful. It helps to make it real, for one, to your brain, to put a name on what it is that you're actually experiencing. But then once you give it a name, then it gives you something to work with versus a nebulous emotion or feeling that you're having. So I think the most important thing would be to acknowledge that you're feeling that way, and it's okay to feel that way. That's an appropriate response.
Okay, so you stated normalizing certain, feelings and symptoms that they may have. How would they know what's actually normal in your perspective and what's something that should be actually alarming or startling?
So that's a very good question. From my perspective, what we look at is how much is the symptom affecting your ability to function on a day-to-day level, right? So is it something that comes and goes, but you're still able to do some of the activities that you need to do? You're still able to concentrate and focus on your day-to-day tasks, be it work or being a new homeschooling parent or taking care of any other tasks that you have? Or is it something that's debilitating and it's preventing you from actually functioning on a level that is comfortable to you or a level that is safe, right? So are you able to do things that are important, like making sure you're taking care of your hygiene, making sure that you're eating, making sure that you're sleeping? Or is this something that is causing you to go into a state where you're not even able to take care of your basic functions? That would be some of the things that I would use to help differentiate, an abnormal state or a state of just anxiety where you're not functioning at your optimal level, but you're also not in a debilitating state where you might need more advanced psychiatric help.
That's very interesting and very helpful actually for our viewers. I know a lot of people get scared with the word normal, and that's been a big concern and debate for people. So your insight in that answer, I'm sure, is very helpful and informative. So currently, with the rise of the COVID-19, the pandemic, has there been an increase in patients due to the rise of COVID?
Very interesting question. One of the things I like to joke with my colleagues on is the um, the stigma that's also there when it comes to patients with mental health challenges as opposed to patients who present for physical challenges. And what I like to joke on is it's the same patient, right? So just because
Hmm.
you are dealing with a mental illness or a mental challenge doesn't mean that you're not going to be dealing with any physical challenges as well, right? So it's still the same number of people, right? There are more challenges in terms of how we address the mental component, especially with patients who require more advanced care, like psychiatric hospitalization with the state of COVID, just because of the additional precautions that we're having to take in ensuring that we can maximize everyone's safety. Most inpatient hospital units, from a mental health standpoint, are open milieus, and so patients usually have their meals their group activities in group rooms where they're around more than 5 to 6 individuals. The ability to maintain 6 feet of distance at all times is just not a feasible reality for most. And so what that prompts in terms of challenges is actual reduction in the capability to take care of as many patients on the inpatient unit. And so triaging is becoming more and more important in terms of differentiating what can be managed in the community, what needs to be managed in an inpatient setting to make sure that everyone stays safe.
Okay, you speak about some of the challenges in regards to maintaining distances when it comes to treating your patients. With the rise of COVID, is there any new advances in technology that doctors such as yourself have been using to just help eliminate some of the people that actually have to be in site when it comes to getting their treatments or their appointments?
But believe it or not, telepsychiatry was a thing way before COVID-19 came about. Um, it wasn't necessarily something that everyone was as familiar with or as open to, but with the rapid progression of COVID-19 and trying to ensure maximize safety, it's been something that even insurance companies have gotten on board in terms of offering coverage for services for. And so most insurance companies are actually covering the cost of a telepsych visit. And there are many different platforms that are used in terms of facilitating that video conference. That choice is up to the facility that is for, providing the service, but it does allow physicians and patients to have that face-to-face interaction while still maintaining safety. For patients who may not necessarily have access to the internet or such, because we do serve a wide variety of patients. We've resorted to the good old telephone, making sure that we're calling up our patients, making sure that we're able to, check in on them, see how they're doing in that setting. And depending on, the challenges that they're dealing with, making sure that we get enough collateral information from the people that are in their homes or, living with them on a day-to-day basis to try to make sure that the patient's actually doing as well as they're letting us know that they're doing, or if not, trying to get more information in terms of what someone else's perspective on the challenges are.
All right, so lastly, the American people need hope that this pandemic will actually blow over. What are some encouraging words or advice that you would tell them to ease some of their anxiety or fears?
So I think as with everything, there is a beginning and there's a middle and an end. The thing that we're trying to address most as healthcare providers now is trying to minimize the number of people who are, one, exposed, or two, that are spreading the exposure. So I think, stay the course. It's going to take time. Unfortunately, it's not something that we can change overnight. But there's a start for everything, there's an end for everything, and there are things that we can do at this point to try to help this end a lot sooner, as well as trying to make sure we keep as many people as we can safe. There are precautions, the general hand washing, making sure that we are cleaning our surfaces, things that people touch, cleaning our doorknobs, cleaning our countertops, making sure that we are washing our hands frequently, making sure that when we go out, we are only doing so, if absolutely necessary. There are many resources available in terms of having groceries delivered to us, ordering things online versus actually going to the store for the things that we don't necessarily need right now. And the biggest thing would be maintaining social distancing. That's been huge in terms of even some of the preliminary, short-term victories that we were noticing in terms of curves flattening or showing some signs of beginning to flatten. The biggest thing is making sure that we're maintaining that social distance so that even if we are asymptomatic and a carrier, we're not spreading it to other people and creating new pockets. Well, that's, pretty frustrating and anxiety provoking in terms of limiting the extent of our social interactions, because human beings are social creatures. There are a lot of different things that we can do at this point with the newfound time that we have, right? So we're not being distracted with a lot of the typical day-to-day nuances of things that we need to do. And so there are different ways that we can cope with that at this point in terms of managing that anxiety or the feeling of the unknown. One of the biggest things that I would recommend would be creating a routine. So this is a new normal. And so how do we structure our day? What needs to be done? What do we have to do? And making a list of those things and then allocating it specific times so that we're still maintaining the semblance of structure. Most of us get up and go to work or get up and go to school. And so how do we maintain that kind of structure without having someone else create that structure for us? Managing how much information we're actually consuming. It is important to stay current and making sure that we're aware of what's going on around us, but an overload of that information can actually be inundating. And so if we're constantly checking sources and trying to figure out, what's a true source or what's just gossip or rumor being spread around, to propagate that anxiety or that fear, making sure that we're kind of scheduling that into our day, so we're getting it in doses versus taking it all in constantly, because the brain works on repetition. And so if we're doing that constantly, we're actually re-traumatizing our brain versus having it be information. It's becoming, a new trauma that we're experiencing.
So I have a follow-up question in regards to that. What would be your suggestion for having a healthy dose of, amount of time sufficiently to just stay updated on what's currently happening so that they're not overbearing, their mind when it comes to these topics?
So I would say pick a credible source or a few credible sources and set limits on how much time you're actually going to spend consuming this news. And I know social media is great in terms of connecting with everyone, but it also allows the platform for people to post everything, right? And so not everything that's being posted in terms of the latest information is necessarily credible. And so limiting the time that we spend just scrolling through news feeds, allowing, proper time to be spent to educate ourselves, but at the same time, what can we actually do to make a difference? And the answer to that goes back to, hand washing, social distancing, and making sure that we do what we can to stay safe and not spread.
Okay, that makes sense. Well, thank you so much for bringing, insight and your expertise into this project. Are there any last minute resources that you suggest our viewers to seek more information?
Sure. One thing that I would say is make sure you're taking care of yourself. And, that means a lot of different things for different people, making sure that we're eating healthy or as healthy as we can, making sure that we're exercising and moving and we're not staying stationary, to help build up some of the natural endorphins that our body actually does make to help us feel better, making sure that we're actually taking time to be present and experience or enjoy the moments. We're not typically able to isolate like this and stay at home and have this amount of time or the ability to structure our day how we want usually. So how can we make this and spin this in a positive light so that we feel like we have more of a sense of control and being able to look at the bright side of things and enjoy the moment that we have. A lot of people find meditation helpful or self-reflection, and setting aside a time to do that. There are a lot of great meditation apps that come with free content as well as subscription content. Headspace is one of them. Calm, Simple, Intimind is another one. Liberate is another app that's available. Another thing that I would recommend would be doing deep breathing exercises that actually helps to calm our body and mind and allow us to focus on something that we can control. There are diaphragmatic breathing exercises that you can Google and find, and they even have some available in Spanish as well. For those who have things like Apple Watches, it actually has an app on it that reminds you, hey, it's time to get up and walk. You've been sitting for too long, or hey, it's time to, do some deep breathing. It actually does help relieve some of that anxiety and stress and give you something to focus on, as well as help improving your physical health as well. Other resources that I would say in terms of people who are struggling with their emotions or limited support systems, there are helplines and phone lines that are available. There's a disaster distress helpline that's available through SAMHSA. You can either call a number or you can text. And, I could provide that information, or that might be something that you
we
can
could
provide
put it
to the
in our
viewers just so
description so
that they
that
can.
everyone has everything needed in one spot. But
That's awesome. The disaster distress helpline through SAMHSA is available. There's also the National Suicide Prevention line that's available, that you can call, or you can chat via text as well, via the crisis text line. And there's also resources available to our veterans through the Veteran Crisis Line as well. There are other resources for people who might be dealing with different challenges as well. And some of those will include the NAMI helpline, as well as the Trevor Project resources for those who are in the LGBTQ community as well, who might want more customized, specialized resources geared towards them. There's also the spiritual and religious community, and I think this is a good time for people to reflect on and reach back to their faith and find some meaning of hope in their beliefs. People believe in different things, and that's okay. And making sure that we're connecting with people who are like-minded with us, and making sure that we stay in touch with our church communities. A lot of churches are offering services online, offering prayer lines online, and that's another way to engage in the social interaction that we're actually craving at this time, but doing it in a safe way. Stay in touch with your friends and family. There are a lot of different apps and a lot of other, technologies that we can use to even have video, live video chat, kind of like we're doing right now, where you're able to talk and see and experience emotion and, watch the facial expressions and all of that, which is some of the things that we do when we have, the physical interaction as well. And so using those resources to help us connect with others as well.
All right, so thanks again for joining us in this discussion and being a part of this project. Stay safe.
Thank you. You do as well.